So we'll continue with the topic. So we had in the previous video we had seen about, like, we started with the diarrheal diseases, where we have seen regarding what is diarrhea, what are the causes of diarrhea, what are the different types of diarrhea. So we have seen different, like, many different types of diarrhea. So now we'll see what are the what is the pathophysiology of this diarrhea. So pathophysiology of diarrhea, it might be due to adhesion to mucosal walls such as E. coli, or it might be due to excretion of exotoxin as in secretory diarrhea, or it might be due to mucosal invasion as in exudative diarrhea, example Shigella and Salmonella infection. So all due to all these things, okay, due to all these three, this usually leads to diarrhea, which might be due to loss of water and electrolyte loss in the loose stool. Okay, there might be this leads to diarrhea, and there might be due to loss of water and electrolyte loss in the loose stool. So that is adhesion of the mucosal wall that is caused by this E. coli, or due to the excretion of exotoxin, which is usually seen in the secretory diarrhea, and might be due to mucosal invasion as in exudative diarrhea, which is done by Shigella Salmonella infections. This usually leads to diarrhea due to loss of water and electrolyte loss in the loose stool. Okay, and electrolyte loss in the loose stool, and that is usually seen that. So mainly in this, due to the loss of fluid electrolytes, okay, due to this loss of fluid and electrolyte, due to this diarrhea. So that is usually when there is fluid loss, is usually from extracellular compartment. Okay, when there is fluid loss, that is from extracellular compartment, that is blood, interstitial fluid and secretion. Okay, fluid loss will be from the extracellular compartment, that is mainly blood, intestinal fluid and secretion. So here what is happening, sodium is lost. Okay, where what is happening, sodium is lost. So how it is lost, in the loose stool. Okay, so when the sodium is lost in the loose stool, this leads to fall in the osmolality of ESF, that is extracellular fluid. Okay, so that is when there is sodium is lost in the loose stool. Okay, when sodium is lost in this loose stool, this leads to fall in osmolality of ESF, and it usually impairs skin integrity. Okay, it usually impairs skin integrity. So when there is loss in this fluid, and when there is a fall in the osmolality of this ESF, this usually leads to fluid shift. Okay, this usually leads to fluid shift as well as electrolyte shift from ICF to intracellular fluid to extracellular fluids. Okay, so that usually leads to fluid shift to fluid and electrolyte shift from intracellular fluid to extracellular fluid. And then due to this, there will be depletion in the volume of ECF, that leads to reduction in blood volume. Okay, so due to this, there will be depletion of volume of ECF, leads to reduction in blood volume, and this results in peripheral circulatory failure. Okay, so that might be results in peripheral circulatory failure. So when there is peripheral circulatory failure, it leads to oliguria, anuria, renal failure and shock. Okay, this when there is decrease in the result, when there is failure in the peripheral circulatory, this usually leads to oliguria, anuria, renal failure and shock. And then there will be loss of bicarbonate in stool. Okay, when there will be loss of bicarbonate in stool, that leads to acidemia and rapid respiration. Okay, that leads to acidemia and rapid respiration. So this usually leads to diarrheal loss of nutrients, that leads to malnutrition and deficiency diseases. Okay, when there is diarrheal loss of nutrients, this leads to malnutrition and deficiency diseases like hypovolemic shock as well as CCF. At last it might lead to death. Okay, at last it might lead to death. So that is usually about this pathophysiology of diarrhea. So normally it is mainly occurring due to adhesion to mucosal wall. Okay, so when there is adhesion to the mucosal wall such as E. coli, or if there is excretion of excretion of exotoxin as in secretory diarrhea, or it might be due to mucosal. Okay, it might be due to mucosal, it might be due to mucosal invasion in the exudative diarrhea of Shigella Salmonella infections, that usually leads to diarrhea due to loss of water and electrolyte, that is usually loss in the loose stool. And this usually, when there is fluid loss, this fluid loss will be in the form of extracellular compartment, that is blood, interstitial fluid and secretions. Sodium is lost in loose stool, leads to fall in osmolality of ECF, impaired skin integrity. Okay, impaired skin integrity, this leads to fluid shift and electrolyte shift from ICF to ECF, and due to this there will be depletion in volume. ECF leads to reduction in blood volume, and this usually results in peripheral circulatory failure, that might lead to oliguria, anuria, renal failure or shock. And when there is happening this, there will be loss of bicarbonate in stool, that leads to acidemia and rapid respiration. Diarrheal loss of nutrients, this leads to diarrheal loss of nutrients, which might lead to malnutrition. And deficiency diseases, hypovolemic shock can also occur, CCF, as well as lastly it might lead to death. Okay, this is about this pathophysiology of diarrhea.